Hello, this is Gene Rossov. I'm president of Iodine Products. We're going to talk this evening about our core visual product. It's called iodine, E-Y-E-O-D-I-N-E. And we're going to talk about the various conditions that it can assist with. There are numerous infectious disease organisms which can affect the several elements of the eye. These elements include the meibomian glands, the eyelids, lacrimal duct, retina, eyelashes, tear ducts, cornea, and all of these features are subject to infections. We can call those infections keratitis or endophthalmitis, and they come from numerous attacking organisms. Iodine, we call ours povidone iodine, and it's a common variety of iodine, especially at the 1% concentration we use, is quite effective at combating all of these diseases, literally all of them. This is especially concerning for the 45 million or so Americans who wear contact lenses. If you're not that familiar with the meibomian glands, which I first mentioned, they are parallel to and inside the eyelid from your eyelashes. They produce a thin, nearly monomolecular layer of a cholesterol-like substance that floats on the outer surface of your eye. It protects your tears from evaporating. If the meibomian glands aren't working and aren't producing the substance they produce, which is called meibum, your tears evaporate very quickly, and then the eyes get dry and itchy and are unprotected from the thousands of foreign objects, including infectious disease organisms, which the wind and the environment blow at them every waking minute of your day. No meibum, no protection, and that equals dry eye disease, more infections, and visual degeneration. One of the increasing problems in the field of eye disease is called acanthamoeba keratitis. 20 years ago, it was very rare. In the last 5 years, over a dozen ophthalmologists have been successfully sued by their patients for missing this diagnosis. And that's because the presentation is quite similar to viral or bacterial conjunctivitis. The Centers for Disease Control now considers acanthamoeba ubiquitous in the United States environment generally, and iodine, especially at the 1% concentration we use, is quite effective against the various life stages of this nasty parasite. According to a recent article in The Lancet, highly respected medical journal, acanthamoebae are relatively common now. And 1% PVPI, which we use in all our products, is indicated in a recent June 21 article in Ophthalmology Science, is the most effective of all possible antimicrobials against this disease. Recently, I've read several articles concerning the increasing prevalence of resistance to chlorhexidine. It's very disturbing and worrisome. In its long history, 75 years or more of use, povidone iodine, PVPI, or iodine itself, has never demonstrated any antimicrobial resistance development, and hence our use of it. There are numerous threats to the cornea from infectious disease organisms, and I'm going to mention a few of them so that this list of them is top of mind for you. Against them all, without exception, iodine is unquestionably effective. One feature of bacterial infection, bacterial keratitis, results from various types of bacteria, including Streptococcus aureus, Staphylococcus aureus, Streptococcus pneumoniae, Pseudomonas aeruginosa, and others. Bacterial keratitis could be caused by any of these organisms. It's typically associated with contact lens wear, with eye injuries, or with compromised integrity of the cornea. There are viruses that affect the eye. Herpes simplex virus, kind of similar to the one that causes your cold sores and things like that, or genital herpes. And varicella zoster virus, which is like shingles, can cause viral keratitis. Herpes simplex virus keratitis can be recurrent and can lead to significant vision impairment. There are fungal diseases of the eye, fungal keratitis, less common, but they can be caused by exposure to fungi found in the soil or plants or organic matter. And you might not be familiar with one called Fusarium, but you're possibly familiar with Candida. And Candida species are examples of fungi that can cause keratitis. And of course, we earlier mentioned acanthamoeba. It's a microscopic parasite that's found in many, sadly, many city water supplies and in the soil, and it can lead to serious acanthamoeba keratitis, and contact lenses wearers are at much higher risk. There are protozoans, microorganisms like Toxoplasma gondii, which can infect the cornea. And this leads to ocular toxoplasmosis, causes inflammation, vision problems, and can actually affect the brain very seriously. That's another fascinating part of our relationship to microbes. There are less common microbes, Nocardia and Mycobacterium, that cause keratitis. And corneal infections themselves can result from a trauma, from improper contact lens use and cleaning, from compromised immunity, exposure to microbial contaminated water. I ran a water laboratory for dozens of years, and the microbes you can find in municipal drinking water are pretty impressive. And someone cleaning his contact lenses in ordinary tap water is simply asking for trouble. To say nothing of eating uncooked chicken and eggs and acquiring toxoplasmosis from there. Several ophthalmologists have mentioned to me that they've actually visualized Toxoplasma gondii critters swimming around nicely in the ocular fluid. And according to the Indiana School of Medicine, 22% of all Americans are infected by T. gondii, and that percentage is sadly growing. In fact, this article calls it the most successful parasite on Earth. I thought we were the most successful parasite on Earth, but apparently it's T. gondii. And while they apparently infect us and cause greater risk-taking behavior, they radically alter the chemicals in our brain to produce unreliable thinking and obviate key elements of rational thought. It's not a trivial problem. We note that as a protective evolutionary act, our key cognitive brain areas are higher in iodine than other sections of the cerebrum. I want to mention a little bit about macular degeneration. This is a very complex and not especially well understood problem that affects a huge number of people worldwide. There's a relatively strong link between chlamydia pneumoniae, a bacterial disease, and age-related macular degeneration. We call it AMD, but really it's macular degeneration routinely. And one of my Harvard colleagues recently published a study on this. Not a direct finding, but compelling. And yes, this is the same fungus that causes lower respiratory infections, fairly common fungus. Our iodine product, in conjunction with our antimicrobial antimycocidal shampoo, it's made of iodine, permethrin, tea tree oil, DMSO, selenium sulfide, is quite effective against Demodex and Demodex blepharitis. I can't say that there's anything else I know of that is. We're working on a new version of the iodine product that incorporates a 1% concentration of tea tree oil, and it has demonstrated very good efficacy against Demodex blepharitis. Demodex comes in two species, a short one and a long one, also called brevis and follicularum. We believe that, and many of the journals believe, of course, that Demodex and Demodex blepharitis is far, far more common than most observers, including and specifically physicians, can possibly believe or know. According to the American Journal of Ophthalmology, dry eye disease, which has a profound relationship to Demodex, affects about 12% of the population over 50. And surprisingly, the statistics on Demodex and Demodex blepharitis are pretty stunning, according to an article in Clinical Ophthalmology. It indicates that of some 1,000 patients they tested who were in the age of 60 plus or minus 18 years, so about 80 down to 40, 58% of them had Demodex blepharitis. And it says, this article says, quote, approximately 60% of the patients with dry eye disease had Demodex and cataracts. So there's a link between Demodex and cataracts. Demodex is present in 100% of patients over the age of 65, but might not have progressed to being Demodex blepharitis, where it has a profound effect on your visual apparatus. It's our theory that most, perhaps all cases of dry eye disease are due to Demodex parasites, both of the nasty little species, the so-called brevis and folliculorum types, clogging up the ducts of the meibomian glands, inhibiting or eliminating meibum secretion, and thereby causing rapid and chronic evaporation of the tears. It's usually protected by the meibum's waxy, oily base. And that allows, the meibum allows for smooth and unimpeded transit of the eyelids across the ocular surface. In the presence of adequate meibum, dry eye disease is enhanced and can become endemic. We have a fourfold approach to controlling, perhaps curing, Demodex blepharitis. Let me outline those four pieces. Number one, since the chance of any patient over the age of 40 having Demodex is quite strong, and Demodex can readily progress to Demodex blepharitis, it's possible to do prophylactic treatment using our iodine product. Of course, patients should go back 2 to 4 times a year for review and reevaluation, and we urge all of our physicians to have their patients return routinely, provide them with enough iodine roll-on bottles for a 2 or 3 month period, which would be 2 or 3 bottles. Each bottle lasts about a month. You probably want to use it anywhere from 4 to 10 times a day. It takes about 10 seconds to use it. It's mind-blowingly simple and very, very easy. You don't have to, it's a roll-on bottle. You don't have to use a dropper. It's just incredibly elegant product. And given the definite propensity for underdiagnosis of Demodex blepharitis and the potential for errors in what medicine calls differential diagnosis and the possible interim development of sight-threatening disease, we recommend revisits to your eye doctor twice, if not 4 times a year. In short, your eyesight is too valuable to take chances with it. That's number one. Number two, the reservoir for this so-called ectoparasite, it's just insanely nasty looking Demodex parasite, is your hair follicles. You have about 100 to 150,000 hair follicles. And once you get over the age of 45 or so, you're going to have anywhere from 1 to 5 of these little nasty mites living in your hair follicles. That means that if you have an average of 3, you've got 300 to 400,000 of them living on your head. So it's prudent to treat them with a shampoo that inhibits and can even get rid of this parasitic arachnid. By the way, they have 8 legs, so they are a kind of, if you will, a kind of spider. They're an arachnid. And the shampoo will get rid of them for a 1 or 2 year basis. So we have this very nice low-cost shampoo, tea tree oil, permethrin iodine, selenium sulfide, that controls and perhaps eliminates the scalp reservoir for Demodex. And the way it works is that given the life cycle of the parasite, we suggest that patients use this iodine shampoo product daily, and shampoo for 2 weeks, stop for a month, and then take up the shampoo for another 2 weeks. Demodex has about a 6-week life cycle. So if you want to get some of the shampoo, just give us a call at our regular phone number. Number 3, a regimen using iodine a few times a day, or even just once daily, will help to control and will likely prevent Demodex infestation of the eyelids, hair follicles, and, importantly, the meibomian glands. It's especially effective when used in conjunction with this anti-parasitic shampoo. Item number 4, last and perhaps the most important element. You might at first find this controversial, but you'll soon enough see the logic, and I hope become persuaded that we're right in this regard. So I ask you first, what do Demodex parasites eat? It's pretty simple. They eat fat, the fat produced by your hair follicles, which is also called sebum, S-E-B-U-M. Well, the more fat you eat, the more sebum you'll produce. And the more sebum you make, the healthier your Demodex parasites will become. They will have more eggs, more babies, more reproduction, and more misery for you. If you want to stop Demodex, you have to starve them. Starve them. Excess sebum production is associated with oily skin and contributes to skin issues like acne and clogged pores. And while for sure genetics and hormonal factors play a role in sebum production, your diet can have a huge impact. So here are some foods that are believed by nutritionists and dermatologists to be associated with increased sebum production. Dairy products. Some studies suggest that dairy products, especially skim milk, how about that, skim milk, may be linked to an increased risk of acne due to their potential to influence hormonal factors. Exact mechanisms aren't understood, but it's thought that the hormones in dairy stimulate sebum production. Second, high glycemic index foods. Foods with a high glycemic index, sugary and starchy items like white bread, pastries, sugary drinks, lead to spikes in blood sugar. These spikes trigger an insulin response. Insulin response causes sebum production. Saturated and trans fats. Diets high in saturated and trans fats, also found in fried and processed food, can promote inflammation of the body, and inflammation stimulates sebum production. Saturated fat, animal fat, cheese, butter, fatty meat, hamburgers, fried French fries. And then we have fast food and junk food. Fast food and junk food are typically high in unhealthy fats, refined carbs, and added sugars, which contribute to an unhealthy balance of sebum production and lead to skin issues. And finally, we have our beloved chocolate. The relationship between chocolate and acne has been a subject of debate for years, decades probably. While more research is needed, some people claim that consuming chocolate exacerbates their skin issues. I'm one of those people. I know it for sure. Here I am at 76. If I eat some chocolate, I get a pimple or two, no question about it. So this is thought to be due to the sugar content and the fat content in chocolate. It's important to note that the link between diet and sebum production, of course, varies from person to person. Not everyone who consumes these foods experiences skin issues. Additionally, genetics and hormonal factors are significant contributors to sebum production. If you're concerned about your skin, you're concerned about your Demodex, and suspect that your diet plays a role, go talk to a dermatologist or a healthcare professional who can provide guidance, suggest dietary changes to help manage your skin health. Additionally, importantly, a diet rich in fruits, vegetables, whole grains, lean proteins can support overall health and well-being of your skin. Let's talk about cataracts. On another ophthalmological front, we note that there are strong and suggestive links between cataract development and a host of infectious diseases. It's persuasive to find in several areas of medicine other than ophthalmology, the relationship between infectious diseases and chronic conditions is being demonstrated with increasing frequency and persuasiveness. I suppose you could say that the intimate links between our microbiome, our innate and adaptive immune systems, and the thyroid's production and regulation of T3 and T4 are, if you will, coming into focus. Iodine, which has been steadily decreasing in the American diet and the global diet for the last 75 years, is critical to maintaining solid immunity. For more information on the catastrophic decline in American iodine intake, you can ask me for supporting clinical and epidemiological studies. Here's a couple of interesting things. Doctors Warren and Marshall were awarded the Nobel Prize for their discovery that the bacterium Helicobacter pylori is a major cause, maybe the major cause, of gastric and peptic ulcers. Keep that in mind. Bacteria causes ulcers. Chlamydia pneumoniae in particular, has become a likely risk factor, possibly a direct causal factor, in the development of pathogenesis of age-related macular degeneration. A very recent article in Harvard Magazine demonstrated a link between immune system stimulus with various strep and staph toxins and cancer remission. This is really interesting stuff. It harkens back to an 1891 Memorial Hospital experience with over 1,000 patients whose intractable cancers were wholly or partially ameliorated with what we then called Cooley's toxin. We've now come full circle to recognize the role of the immune system and its challenges in effectuating cancer cures. Infectious diseases apparently can increase the risk of cataracts, directly or indirectly. And these diseases may lead to cataracts due to inflammation. Can come from the use of medications to treat the infection and other associated factors. So some infectious diseases and their treatments can be linked to increased risk of cataracts. And these infectious diseases, there's a long list of them. There's rubella, German measles. Rubella is a viral infection that can cause congenital cataracts in the developing baby. Chlamydia pneumoniae, again, it's linked to macular degeneration and various eye diseases. Toxoplasmosis, caused by this nasty little wormy parasite called Toxoplasma gondii. And it leads to eye infection and cataracts. Herpes simplex virus, particularly what's called ocular herpes in your eye, causes inflammation and scarring of the cornea of the eye, leading to cataract formation. Then there's another virus called cytomegalovirus, common virus, causes eye infections and inflammation, theoretically increases the risk of cataracts. Syphilis, a disease you don't want to have if you can possibly avoid it, more and more common these days. It can cause eye inflammation and damage to the eye structures, leading to cataracts. River blindness, which you probably won't get, it's caused by a parasitic worm, Onchocerca volvulus, and leads to eye inflammation, including cataract formation if untreated. Trachoma, caused by a fairly common bacterium called Chlamydia trachomatis, is a chronic eye infection, leads to scarring and clouding of the cornea. And of course, HIV/AIDS, people living with HIV/AIDS are at an increased risk of eye conditions, including cytomegalovirus retinitis, which can indirectly lead to cataracts. I want to mention a little bit about glaucoma. Glaucoma is primarily related, of course, to increased intraocular pressure. However, some infectious diseases affect the eye and contribute to intraocular pressure and what's called secondary glaucoma. And they can lead to this elevated intraocular pressure due to inflammation or other complications. Iodine wholly or largely prevents the development of these infections. For example, HSV, herpes simplex virus infection, particularly causes herpes simplex keratitis, leads to corneal damage, inflammation, causes increased intraocular pressure, secondary glaucoma, can be treated with iodine. Cytomegalovirus retinitis untreated leads to inflammation affecting intraocular pressure, and various fungal or bacterial endophthalmitises can devolve into intraocular inflammation, scarring, and increased intraocular pressure. So these infections, some of them rare, may result in secondary glaucoma. Toxoplasmosis readily causes retinal inflammation, toxoplasmosis, retinochoroiditis in some cases. It leads to elevated intraocular pressure, glaucoma-like symptoms. Syphilis does the same thing, including a condition called uveitis and other inflammatory conditions which impact and cause and relate to intraocular pressure and glaucoma. So please note, we are a 24/7 operation. You can call us anytime at 305-667-9375. Our goal is to serve you, to serve doctors, to serve patients, to provide product support and insights to the best of our ability. We have some very unique approaches to key ophthalmological issues. Infectious diseases are changing as rapidly as our world's temperature, and our approach to industrial farming doesn't help much either. So you can call us any time to order our products. We can direct you to our various websites. All of our products have their own websites, and discuss our approach or find out if what we're doing is a good fit for you as a doctor, for you as a patient. And we're delighted to talk to you. You can call us 24/7 at 305-667-9375. Thanks so much for bearing with me.